about mind fitness. So that's the psychological wall of our toolbox, and we will be talking about the Mind Fitness Method to manage stress and prevent burnout that I've kind of developed based on acceptance and commitment therapy and positive neuroplasticity. And it's basically a way we were talking about before about playing using mindfulness, so that's the first part, the SOAR, to play our stress edge so that we don't go into a zone of overwhelm, becoming aware with mindfulness when we are pushing it into that zone of overwhelm, and then asking ourselves what we need to stay in that zone of challenge. So developing resources such as kind of compassion and mindfulness and grit and a lot of inner resources that we can develop by rewiring our brains so that we can stay in that zone of challenge and actually prevent burnout. And so the way that I kind of explain this acronym is that the SOAR part is the mindfulness. So if you're thinking about what happens in life, life gets lifey, things happen, the stresses of the medical profession, and what happens is that's the pain of what happens in our life. It's in our hands. But when we cause ourselves struggling is when we resist it. So struggling is pain times resistance. And so what happens is that we resist it. And then also what happens is that we become we start to also say that we're not good enough, we beat ourselves up. So this is the resistance, we beat ourselves up. And then we also become fused to our thoughts, we strive, and we become what's it called cognitively fused to our thoughts, and that's what stress is. And so what happens when we're in this position is that, in that sense of overwhelm, is that we can't see what is happening in our lives. We can't enjoy our children, we can't enjoy our work, we can't enjoy our hobbies. We're just kind of in that zone of fused stress and overwhelm. And so what mindfulness does, so this is the first part. So the acronym is SOAR, so stop. So the first thing is to stop and surrender to our senses to come into the present moment. And then when we're in the present moment, we can observe our thoughts and feelings. So we can bring them away from our face. We can observe our thoughts and feelings, and we can kind of name them to tame them. So we can say, I am having the thought that I may make mistakes, or I'm not a good enough doctor. And so that kind of creates some distance rather than I am not a good enough doctor or I am stressed. And then also naming the emotion that comes up with that, which may be that of anxiety. So I am feeling anxiety at that time. So that's the O. And then allowing it. So observing it, allowing it. So watching it, observing it like a curious scientist. So what's that anxiety kind of feel like in your body? Is there a color, or has it got a shape, or is it moving, or is it still? And kind of allowing it with kindness. So feeling it to heal it is the other acronym. And then releasing any thoughts that might be associated with that. So releasing those thoughts of being an imposter syndrome. And that's kind of cognitive diffusion strategies that we'll be talking about. And then we can kind of let it be. We can let the pain of life be in our hands without adding to it. We can become aware of where we are in our zone of challenge or overwhelm. And then we can ask ourselves, we can acknowledge that we're not alone as women in medicine. And then we can ask ourselves, what do we need to stay in that zone of challenge? So what do we need for ourselves? So that's the the ING of the soaring. So investigating, what do you need? Do you need kind mind, which leads to kindness? Do you need calm strategies, which leads to kind of calm? Do we need connection? Do we need boundaries in our lives? So asking ourselves what we will need, and we will talk more about that in the investigate part. Then we feel, do we need contentment and gratitude? And then what we need to do when we feel those things in our body, like we feel that sense of calm, we nourish it with all of our senses. So this is what we need to do to rewire it into our brain. So if the example I give is about feeling that sense of gratitude of watching a sunrise, not just kind of, oh, that's a nice sunrise and going on past, or that's a nice sunset, stopping and seeing the colours in our senses. What do we actually smell or taste or hear bird song around us? So we nourish that experience so that we can become more kind of Velcro for the positive, because we're so Velcro for the negative. So we've got to train our brains to become more Velcro for the positive. And then we can grow, the G is growing neurons or synapses in our brains by giving it 3 deep breaths. So research shows that if you give it 3 to 5 breaths, we start to actually rewire the synapses in our brains. So that's the basis of the SOARING system, which we'll go through in the next few days. So don't worry if that's a bit overwhelming, but that's the kind of rationale behind the SOARING system. So the first part is mindfulness, and the second part is positive neuroplasticity and how we can rewire our brain. So mindfulness resets our nervous system, and positive neuroplasticity rewires it. So yeah, really excited to share this all with you in the next few days. So that's it, day 5, mind fitness, and tomorrow we'll do the first one, which is to stop. Okay, namaste.
If you want to learn more about the Mind Fitness Doctor, then download my free ebook, The Stress Reset Toolbox for Women in Medicine, or join me in my 6-week Mindful Self-Compassion for Medicine course, or the 8-week MindFit Doctor course, How to Manage Stress and Prevent Burnout in Medicine, the Mind Fitness Gym membership for Women in Medicine, or my Recharge Retreat.